Welcome back, ladies and gentlemen, to Equillium's channel, leveraging a deep understanding of immunology and its role of disease to pioneer new products for severe autoimmune and inflammatory disorders. Joining us, Bruce Steele, the Chief Executive Officer, is going to give us some insight today on some recent news and some of the 2023 outlooks as we finish up the year. But first and foremost, welcome back, sir.
Thank you very much for having me again.
Always a pleasure to get you back on. So I'm just going to kick this off with one of these recent headlines that Equillium and Ono Pharma announced an exclusive option and asset purchase agreement for the development and commercialization of Equillium, if I said that correctly. Do you want to break down this part of your pipeline and what this partnership means?
Sure. This was a very important partnership for us that we announced last week with Ono Pharmaceutical. If you're not familiar with the company, they're one of Japan's top pharmaceutical companies. They are actually the originator of Opdivo, the first checkpoint inhibitor approved to treat cancers. Very established, respected company. And they took an interest in our program, Equillium, earlier in the year. And what we announced last week was a strategic partnership whereby they now have an option to acquire our program and our rights to Equillium. For that option, they paid us an upfront payment of $26 million, and very importantly, committed to fully fund the entire Equillium research and development program through this option period, which we expect will take approximately 2 years or so to play out. During that time frame, we're conducting all of the clinical development, and we have two key data deliverables over the option period. One is the top-line data from our ongoing study in lupus nephritis patients. That's the Equalize study. And then the planned interim data from our ongoing study in acute GVHD, that's our phase 3 Equator study. After the delivery of those two data sets, they'll have a 3-month period to either opt in or opt out of the program. If they do exercise their option, we'll receive another approximately $37 million in an exercise payment fee. And then we also are eligible to receive another $100 million in milestone payments that cross clinical regulatory milestones as well as first commercial sales. So for us, it was very important to extend our runway significantly. We're now funded well into the 2025 timeframe, so in excess of 2 years of cash runway. That's critical for us, certainly in this time where capital markets are tight in the biotech sector. So we've funded ourselves very robustly and significantly past key data sets that we're expecting to generate during the course of 2023 around our other pipeline assets, our lead multi-cytokine inhibitor EQ101, which is our antagonist against IL-2, 9, and 15. We're currently studying that in a phase 2 study in alopecia areata, where we should have data during 23, as well as our EQ102 program, our antagonist against IL-15 and 21, which is currently in first-in-man studies that will include an evaluation for proof of concept in patients with celiac disease during the course of 2023. So we're very excited about our entire pipeline, including our wholly owned assets that I just described, and the fact that this Ono partnership gives us 2+ years of cash runway.
I think you hit on every aspect that matters here, some 2023 highlights and extending the runway and just touching on those tumultuous markets. This is very fruitful, to say the least. So I will pass the question off to the viewers. We'd love to know what you guys think about this in that comment section below, and consider subscribing, because as news continues to hit the wire, of course, we're going to update you here. But stay cool, stay awesome, and as always, we look forward to catching you in the next one.